This webinar is brought to you by Lyme Disease UK. The aim of the webinar is to give you an overview of what Lyme disease is, what causes it, how to prevent it, and how to recognise it if you think you might have contracted it. Lyme disease is a bacterial infection and is caused by a corkscrew-shaped bacteria called Borrelia. Lyme disease can be transmitted via an infected tick bite. Ticks can also carry other infections such as anaplasma, babesia, and tick-borne encephalitis. Ticks are from the arachnid family and can be as small as poppy seed. This slide shows the life cycle of a tick. So from the larval stage to the nymph stage, the female and the male, as compared to a 5p piece. You are more likely to be infected by a nymph tick or a female tick. This is a photo of a very small child. The photo has been enlarged many times to show you how ticks like to embed in warm, hidden places and can be missed by the person who's been bitten. This small child, the mum did find the tick in the end, and he wasn't infected, but it's a good illustration of places to look for embedded ticks. Ticks can be as small as a poppy seed, and this image highlights just how small they would be. This is a nymph tick that's been extracted from the skin. Lyme disease is now found all over the UK. Infected ticks have been found in every region of the UK, are found in woodlands, parklands and heathlands, but have also been found in urban parks and even gardens. You may be infected in any month, but most likely in the spring and summer. In 2015, the Big Tick Project found ticks on 1 in every 3 dogs that vets saw in their surgeries, which owners were totally unaware of. How do we prevent Lyme disease? So prevention is much better than cure. Wear insect repellent and consider treating outdoor clothing if you have a risky occupation, like for instance in forestry. You can buy clothing impregnated with repellent. Wear long sleeves and long trousers. Tuck your trousers into your socks. Stick to pathways and avoid long grass. Do a thorough tick check and have a shower when you get home. Also use tick prevention on your pets and check them thoroughly for ticks regularly. You can ask your vet for advice about tick prevention. Once ticks brush onto somebody, it could be an animal or it could be a human, they actually do a thing called questing, which means they sit on the top of long blades of grass and wait for a meal to go by. So ticks are looking for a blood meal, so anything that they can have a blood meal from. If they brush onto you, they like to climb up to nice warm areas. And this slide shows all the places that ticks like to climb up to and need checking when you do your tick check. Be especially vigilant with small children because they love to hide behind the ears and under the hairline. Removing a tick. Never pull off a tick with your fingers, normal tweezers, or any other tool not designed for the job. Never smother the tick in oil or Vaseline or anything not designed to remove it. The reason for this, if you stress a tick before removal, it will react by regurgitating the contents of its stomach into your bloodstream. So if it is an infected tick, you're more likely to be infected. Carefully remove it using a tick remover that you can purchase or a pair of very fine nose tweezers, ensuring all parts of the tick are removed. There is no minimum time a tick needs to be attached to pass an infection. However, do remove it as soon as possible. Lyme disease can be hard to diagnose. Tick bites are easily missed and are not normally itchy or painful. Some people will get the classic bullseye rash. Its correct name is Erythema migrans, which is absolutely typical for Lyme disease. But unfortunately, about 30% of people with the infection will not produce a rash. Other symptoms to look out for are summer flus, headaches, fatigue, swollen glands, joint pain, and in smaller children who can't articulate how they're feeling, behavioural changes. Like many children who are ill, will become clingy, unhappy, maybe change their sleeping habits. So that's something to look out for. We have a blood test for Lyme disease, but it cannot totally rule out Lyme disease. And this is because of the type of testing it is. The tests we use in the UK is not reliable in the first 4 to 6 weeks after a tick bite. And if the testing is done within this time, the test should be repeated. This is because it's an antibody test and it can take the immune system between 4 to 6 weeks to make the antibodies to the bacteria that causes Lyme. We currently have no NHS Lyme disease specialists. An Erythema migrans rash, sometimes known as a bullseye rash, has a very specific mode of behaviour. The image here is what we would say is a typical bullseye rash, but unfortunately they don't all look as neat as that. So the behaviour to look out for is that the rash will take at least 3 days or more, can take up to 3 months to appear. Generally isn't itchy, painful or hot, and slowly spreads outwards. And it is this spreading that is the hallmark of Erythema migrans. Erythema, redness, migrans, migrating, spreading. It's also good to be aware that not all Erythema migrans looks like the very typical rash, and they can have a bruise-like appearance, a solid appearance, and on darker skins they can appear very differently. Early treatment provides the best chance of recovery. An Erythema migrans rash is diagnostic of Lyme disease in itself, and treatment should be started straight away. Your GP will be able to advise on the best antibiotics for you. Doxycycline is commonly prescribed for adults and amoxicillin for children. The nice guideline for Lyme disease now allows for 2 courses of 2 different types of antibiotics depending on symptoms. We currently have no blood tests that can test for cure for Lyme disease. Flu-like symptoms after a tick bite are very common, and because we have a pandemic still ongoing at the moment, it's wise to be aware that there are some crossover symptoms. So this image, and it's also on the Lyme Disease UK website, is a useful check-in point, and you'll see which symptoms overlap and which don't. So we have some resources that people can refer to. So our website is lymediseaseuk.com. The NICE guideline for treating Lyme, which people can refer their GP to if they're unsure of how to treat Lyme disease. The Royal College of GPs has also produced a very good Lyme disease toolkit, which again, you can refer your doctor to if he's a bit unsure. Although ticks carry the bacteria that cause Lyme disease, it is estimated that only about 10% of ticks carry the infection. So the aim of this webinar is not to say to people going in the countryside or a tick bite is a given for Lyme disease. But because we don't know which ones carry the infection, the prevention methods we've talked about and being aware of Lyme disease in the first place and what ticks can pass on to humans is very good to be aware of. Thank you for listening today. If you would like to make a donation to help us continue our work, please visit www.lymediseaseuk.com/donate. Thank you.